started. My name is Sergeant Jeff Stewart, the City of Garfield Police Department in Garfield, New Jersey. Also the Age Friendly Project Coordinator for our city. I'd like to introduce Miss Darleen Reveille, RN, our former Public Health Department Coordinator and nurse. She's been key to our age-friendly initiatives here, not only locally in Garfield, but the county as well. She's now with the Harpour Group Consulting. Darleen, if you'd like to say a couple welcoming words.
Oh, you're muted. We can't hear you.
I will come back to Darleen. Oh,
sorry. Good morning, everyone. I'm happy to be here.
All right, so what we're going to discuss today is, number one, what is collaborative policing and the collaborative policing model? How is it important to law enforcement and public safety for age-friendly communities? And how it's important for coalition building, and how you could use these principles to build out your age-friendly initiatives and coalitions in your own cities, towns, townships. So we're going to start by definition. The collaborative policing model is a problem-solving, evidence-based policing program that builds trust and support and cooperation in the community, while being effective in bringing everybody together, bridging the gap between cops and community. And it kind of takes community policing, the traditional meaning of community policing, to the next level. How we utilize it in older adult communities and why it's so important is it includes socialization for all ages, things like fraud protection. People will usually prey on older adult communities, so we want to get in there and we want to really address these issues before people are taken advantage of. We need to address different things in mental health, stigma-free, different community activities. We want to be able to identify food insecurities and social isolation before it becomes problematic, especially coming out of the pandemic, where these issues are, more and more and more. And we need to understand our communities to be able to help them. Usually law enforcement is first on scene for medical emergencies, and we just don't want to respond to call after call after call and not really understand our communities. We don't want to put a Band-Aid on things. We want to actually be able to solve the problems with the collaborative policing model. The next slide. We established our Community Affairs Division here in Garfield in the 1990s. I was appointed commander in 2019, and we found it really, really important growing not only our age-friendly initiatives, but our Community Affairs Division through support of leadership within the city, through positive social media, through a physical presence in the community, and support others doing similar work. We found that we need to really work with one another, and that's what builds not only our community, but our age-friendly community as well. You want to be out there working with your Boys and Girls Clubs. You want to be out there working with your faith-based community, with your age-friendly community, with AARP, with your national and state organizations, with your local government, your state government, and your county government, and really take it to the next level. You can switch slide.
You're good.
So these are a couple of the programs that we've done. We've hosted pop-up barbecues. We've had little coffee clutches where we'd address some fraud topics. We've run programs with 800 Gambler on internet gambling and awareness, where you could get help if you need. We try to have exercise programs. We try to really get out into the community and make that difference. Relationship building is key. We insert the education and training. And like I said earlier, we want to be more productive in our contacts from a police perspective and also from an age-friendly perspective. So with these couple of slides, we really jammed in hours of instruction that we go out and do, not only in our community, but other communities. So I really want to open up the forum to answer any questions or hear what everybody else has to say, so we could learn from each other and take it from there. So does anybody have any questions?
I can stop sharing if we're gonna do kind of Q&A and
Yeah, I think
more
that's
conversation.
the best for conversation now than
I
just talking.
I agree.
While we're waiting for people to, if they have any questions, I just like to add that I embraced this concept when many years ago when Sergeant Stewart came to me and we were working on a project for safe streets together for pedestrian safety, especially around biking and walking. And it just made a natural partnership with the public health department and the police department to work together. And that was way back in 2006. And if we look at today's day and age and what's happening with communities and the relationship with police and the call for reform, this is the way to do it. This goes beyond just raising awareness. This provides a solution. Sergeant Stewart has worked tirelessly. And if one testimony that can speak to this, he was just named the honoree by our Hispanic Alliance for their honoree of the year this year. That just shows you what can be done in a community to deter crime, so that crime, you're not dealing with stopping crime while it's happening, you're truly preventing it, and you're building a relationship and changing the dynamic of that relationship with police departments. We need to move beyond raising the awareness, and we need to come up with solutions that create strong communities that understand that we need to be community for all ages. That's why Garfield named their initiative in Age Friendly, Generations for Garfield. Isolation is a problem, and having people work in silos, we know that that's a problem, and not just for the interagency, but the community as well. We need to bring people of all ages together and promote equity and alleviate that social isolation that became so much more apparent during the pandemic. So this is our way of, we're happy to present here, and we just want to support all agencies, the police department, the health department, our YMCAs, Boys and Girls Clubs, the Rotary Club, the VFW post members. When you build these coalitions, communities are stronger. Yep, sorry.
Sorry, I got another Zoom pop up, so that wasn't for you. I'm sorry to interrupt.
Oh no, that's okay. I could talk forever. I'm so passionate about this. So it's a good thing that you did that. So in case we have some time, if anybody has a question.
Yeah, this is Cassandra. Really appreciated this overview and that stat on the last side about, what was it, like 70% of all adults who have dementia are still living at home, which that's a pretty kind of shocking stat. And it sounds like you've done a lot of work in your own community. What would be, as I come from the supportive housing world, what would be a good way to engage the local sheriffs or police department in understanding if they're able to access this type of training? Is it just kind of, what would be a good way to start that conversation?
So I think a good way to start is, just they say success is seeing the people, and every no is closer to a yes. Overall, our leaders are largely older adults. So we're all going through the same thing. I'm 47. I'm almost ready to join up for AARP myself. So we're all going to get there sometime if we're not there already, and we really need to support the age-friendly initiatives and aging in place, and seeing that our future older adults are going to be, in a safe spot and living fruitful lives, as well as our current older adults that are currently aging now. I think the best way is to just, go in and ask for the commander in the community affairs division, if they don't have one, a captain, somebody in charge of patrol or operations, and just say you'd like to have a casual conversation of, hey, have your officers taken the training for dealing with people with dementia? Have you gone out there in the community, and are you more understanding with social isolation? What are you doing to, bring prevention messages from your department to these parts of the community? And, I would say 99% of the time that conversation is going to be welcomed by any PD administration. And it has to be a learning thing. They need to learn from you, you need to learn from them, and at the end of the day, work together to deliver that message of age friendliness. And, is it going to work every time? No, unfortunately, there are people who, I wouldn't say they don't care, but maybe they don't have the time, or it's not number one on their radar. And if that should happen, you just go to the next step. Go to your mayor and council, go to your first aid squad or ambulance corps, go to your fire department. You need to really get out there, and you'll find that even when you've been turned down initially trying to put these actions into place, once you're out there and once people see that you're successful with your age-friendly coalition, age-friendly community, they're going to want to jump on board, because people want to jump on board with a winning team, and that's just the facts of life. So that person who shoved you away 3 months ago, when you keep moving forward and keep going ahead with the initiative, you're going to find they're going to call you and say, hey, Cassandra, I really didn't have time to talk to you about this, but why don't you come by? Let's have lunch. Let's get this program going, because nobody wants to be left out of the game when it's winning.
Yeah, that makes a lot of sense. Thank you.
Data's all, I was in another session earlier, we were talking about data and database advocacy. That's something that we do a lot of in Bergen County. I don't know if you're in Bergen County or another area, or if you're even in New Jersey. I would assume you are, but I'm not sure. And data helps. Like the other statistic we put up there was that 90% of the time a police officer reaches an emergency call first, so before the EMT or the ambulance. And so that's an important statistic too. How do you deal with a dementia patient if a family member's called 911, or even just an older adult who might be confused or have an infection? Or I'm sure you're familiar with these scenarios if you, it sounds like maybe from your experience. So data can be really helpful in that situation also.
And the fact that the police are usually the first responders on a call from the older adults in the community. And then if everybody's working well together in this coalition, they know exactly who to reach out to get the services that that resident needs. And also, Jeff, if you could talk about how your relationship with the housing authority led to your the substation being in public housing.
Yeah, so my community affairs precinct is actually dubbed the Engagement Center, and it's in public housing. And the reason we did that was twofold. We wanted to be, very close to our community. We wanted to give community members of all ages the opportunity to come into the police department in a non-confrontational way to address issues that, may concern them, but they're intimidated going into the main headquarters. We also wanted a place for multi-generational activities, neighborhood mediation, different meetings, community town halls to be held. So we wanted that safe space with the community where, we want to show that we have a heart behind a badge and not an ego. And that's just not my sentiment. That's the sentiment, thankfully, for our whole department here in Garfield. And, it's worked out really well. We do diabetes prevention programs, health and wellness, drug prevention. We do some older adult arts and crafts programs. We do things for our veterans. So it's a way to just engage and to be active. We have a special needs program that runs out of our office with children. I call them children with multiple abilities. They go and they learn life skills, how to wash dishes, how to cook meals, basic things that they're going to need that's really only taught in books in high school. We got them into an actual, living setting where they could take those skills and now when they age out of the programs, get meaningful work, meaningful jobs, and move on to live good lives.
Yeah, those are all really great programs. I'm from a nonprofit that has kind of like a statewide presence in New Jersey, and so we'll just keep this in mind as we support different aging initiatives that are happening across the state.
Yeah, if anybody ever needs, any advice, any questions, myself or Darleen from the Harpour Group would be glad to help you out. We work for free. We're here for you guys. It takes a village, and we're here to work together. And I try to learn each day, be 2% better each day, as we say. And if I could learn something from all of you, and you could learn a little bit from our initiative and our team, that's what we need to really take age friendliness from, our cities and townships to our counties, to our states, and then eventually to the US. We're blessed enough to present this collaborative policing model with the age-friendly component nationally at the International Association of Chiefs of Police this October. So we're super excited about that, to really advocate for age friendliness on a national scale, not just a local scale. And I think that's how we need to really drive it home. And every day that we can get one more city, one more organization, one more coalition or police department on board, that's a win for us and a win for, everybody.
And Shannon's also is our executive officer for the Harpour Group. So she's part of our team. And we're looking forward to making a difference.
Yeah, congratulations on the upcoming conference and being able to present to the audience. I used to work in criminal legal reform, and so I'm familiar with that group. So yeah, that's awesome. And it really is about building these local relationships, so important to public safety.
It's the most important thing. You're spot on.
It makes everyone's job easier at the end of the day.
Yep.
Hi, Althea. Anyone else have any questions? We have 3 minutes left, and then they're going to bounce us out. No? Okay.
As Sergeant Stewart said, we're happy to help. So if anybody thinks of anything later on after the fair is over, you can contact us, and we're happy to share what we've learned, what works and what doesn't work. Sometimes the best changes in your strategy come from things that you found out that didn't work well.
We want to see all of you succeed, which builds your coalitions and builds this initiative. Without all of your success, we have no success. So we're here. We always pick up the phone for any of you. And we just want to make things, bigger and better. And, that's what we will do over the next few years. And we'd love to take everybody with us.